Okay, so in this one, we're gonna go over the womb's cycles, and pretty much how we talk about this in a way that makes sense, how we can understand it. So, first, your cycle day one, if you were to track your cycles, is starts at the very first day of your period. When we call that menstruation or your period, and we know that menstruation is when our womb begins to shed the uterine lining, so the lining of the uterus. And during that time, estrogen and progesterone levels are very low. And we know that estrogen and progesterone are two very important hormones in a womb for women. Okay, yeah. Okay. Also, during the period, your cervix tends to be low and firm, and we know that the period is like when the womb is cleansing and releasing. There is usually little to no discharge aside from blood and spotting when you're on your period.
Abundance.
Abundance.
Okay.
Wow.
Okay, next we have the follicular phase. And this phase has a lot to do with the ovaries, and it starts from the first day of your period all the way to the day of ovulation. And basically during the follicular phase, it is sending messages to the brain telling the ovaries to prepare to release the egg. And so this phase starts from the first day of your period all the way to ovulation when the egg is released. And then right after that is the proliferative phase, they call it. And these two phases coincide, except the proliferative phase starts during the end of your period, whereas the follicular phase begins on the first day of your period. And during that time, the proliferative phase, main thing is the uterus and what's going on in the uterus around this time. And so after your period, the uterus is just done shedding its lining, right? So then it's beginning to build up a thick inner lining again. You know, the same, basically like how it just shed, the one that it just shed. And the endometrium, which is the lining naturally, is becoming thicker. That's what's happening. So it's building it up. So it's becoming thicker. And during this time, estrogen levels are rising. Right. And then next is ovulation. And on an average, ovulation occurs 5 to 10 days after your period, after the last day of your period, right? So then we know what ovulation is. The egg is released from the ovaries, and we know that during the follicular phase, that's when they started already sending signals to the brain, to the ovaries to release the egg. So now let the signals have gone right. Your egg is preparing to be released from the ovary into the fallopian tube. And the rise of estrogen is sent to the brain, or it signals to the brain, and then the creation of the hormone called the luteinizing hormone is present, and that's called for short LH. And most women, either women who are, just know about the womb or have done like fertility treatments or trying to conceive, will more know about this hormone, because this is the hormone that comes out when you take, like, if you were to take ovulation tests to test when you were ovulating, when you're peeing on it, because you take an ovulation test just like a pregnancy test, and when you pee on it, either one line will show up or two lines will show up letting you know that the hormone is present or not, right? So then we get on to the luteal phase. And the luteal phase is seemingly the longest phase of the womb, because that one is from ovulation to with your next period. So when your cycle starts over again. And around that time, yeah, lasts roughly about 2 weeks, because around that time you would, on average, if you have normal periods, you would be on around like day 14 or 15 of your cycle. And then so during the luteal phase, the sac that contained the egg that was released during ovulation produces estrogen and progesterone. And once ovulation occurs, the egg transfers into the corpus luteum and begins to produce both of those, progesterone and estrogen. And this is why the rise in progesterone is why women will feel lots of different symptoms follow in the luteal phase, so following after ovulation. And so it's also during this time when these hormones are fluctuating like this is most time when people will notice that they get PMS symptoms, or some people who are like trying to conceive will notice that they get like mock pregnancy symptoms without the pregnancy though. So then yeah. And then the last phase that we have is the secondary phase, which coincides with the luteal phase. It is from ovulation to the next period. Oh, and hold on, before we get to the second phase, also what happens in the luteal phase is that like we said, the progesterone and the estrogen levels rise, and then the rise in progesterone is why you feel certain symptoms. And if the corpus luteum, so the rise in progesterone also helps to support pregnancy. So if the corpus luteum, if pregnancy did not occur, like if fertilization did not occur, then the corpus luteum will start to break down, which causes a drop in both estrogen and progesterone. Also, a lot happens during the luteal phase, and this is why if women are having hormonal imbalance, this is when you will notice it most, because PMS symptoms and stuff are also hormonal imbalances. It's just things that are occurring when these hormones that we speak of are not in balance with how they should be within your body. So then that's when all these symptoms come in, right? And then also the secondary phase, like I said, coincides with the luteal phase, and that's when the lining, for the uterus, the lining of the uterus secretes chemicals that will help early pregnancy, or help the uterine lining to break down, right? And the whatever, like, now I'm mixing up the words, but you know what I mean. The endometrium prepares for pregnancy or breakdown, and the rise in progesterone cause the endometrium to stop thickening to prepare for potential attachment. So basically, the secondary phase is just what's going on in the uterus, and the luteal phase is more about what's going on in the ovaries. But between all of that, that's just understanding the cycles. So this is pretty much all of this that I just mentioned occurs on a cycling basis. So always from your next period from the first day of your period to the first day of your next period, all over again. That's our own personal cycle, right? And so and they say that the average one lasts is like a 28-day cycle. But you have to track your cycles to be able to notice if they are consistent, because sometimes they are not, and that could be for different reasons. And the inconsistency of the cycles will also show if you have what they call irregular cycle, because now they say a regular cycle is not always going to have to be the same day. They say at least if your cycle is from 25 days to like 32 days, within that same range, like it comes around that time every month, that's considered regular. But anything cycles coming more frequently than like say 20 something days are considered irregular cycles. And then there's different stuff going on, and then you have to understand it based on how your body's pacing it. But all this is what happens. And basically what I realized was that when you're learning how to cleanse the womb, or just working with the womb, or being in tune with your womb in general, you there are certain herbs that you could take, that you should take during the different phases of your cycle to support the things that are going on. Because we look at our cycle. Dream, be quiet. Could you give me some water? Okay. We look at our cycles and we don't pay attention. We look at our cycles and we don't pay attention to the fact that it's not just the period and the ovulation going on. There is also many things that go on in between that, where you can understand actually what's going on with your womb. Oh my goodness. And I was realizing that you should take certain different herbs. So during your period, you can take gentle cleansing herbs and soothing herbs. You don't want to take certain herbs because certain herbs promote bleeding, and you don't want to do any more bleeding than you have to on your cycle. just like eating certain things when you're on your cycle can cause you to bleed more. And that's what I realized. So you really cannot, you want to avoid cold things when you're on your cycle, or all the time. But when you're bleeding, if you eat a cold thing, you might notice that you will start to bleed more after. So if you start eating ice or popsicle or something like that, you might notice that. And then so you want to take gentle cleansing and soothing herbs when you're on your period, but herbs that still help the womb in doing what it needs to do. So that's gonna be like red raspberry, and some ginger, maybe chamomile, and stuff like that, herbs like that. And then after your period, somewhere between your period, after your period, and before ovulation occurs, you're going to want to start taking herbs that help to stop the spread of infections, balance the bacteria in the womb, and herbs that are also like anti-inflammatories, all herbs that help to keep that balance, because your immune system lets its guard down in preparation for ovulation. So a lot of women will notice after their cycle and in between ovulation, or when ovulation is supposed to be occurring, that they are dealing with not even with hormonal imbalance, but bacterial imbalances. And that's where infections and stuff occur, like yeast infections and BV and vaginitis and all of that stuff, and UTIs and stuff. So yeah. And some herbs that stop the spread of infection, balance bacteria, anti-inflammatories and stuff like that are going to be like clove, ginger, dandelion, red clover, and so herbs like that, basically. And then during ovulation, you get like options. So during ovulation, naturally, after taking cleansing herbs, you always want to take some like revitalizing herbs, like, herbs that are like gentle but go in and just restore the body. Like they're more like some herbs are like herbs that are like corrective herbs. Like they go in there and they stop shit. Like dandelion goes into your womb and it stops bacteria, it stops the spread of infections and bacteria and stuff like that. So it's like boom, that's a cleansing herb because it goes in there and it cleanses immediately. And some herbs go in there and they providing you with what you need. So they just boosting up your levels and stuff. You know what I'm saying? Like so you want to take some herbs like that, or you want to take some contraceptive herbs during your ovulation, during your fertile window. So when you, because there's a window that's like a week long of when ovulation might occur, you know. So when you're in your fertile window, you might want to stop taking like contraceptive herbs like holy basil or neem, and that way to prevent pregnancy naturally before fertilization even occurs. And then though, if you're taking some revitalizing herbs, and you also could take some herbs during ovulation that help to increase the cervical mucus. So we're talking like red clover, naturally sea moss, what is it, primrose oil, because that helps. Primrose oil, it's an herb, and it helps to increase circulation, not circulation, but cervical mucus. And then you want to eat things, certain things you eat can also increase cervical mucus, like okra and yeah, there's more off the top of my head though. And hormone balancing herbs. So once you get into the luteal phase, because the hormones are doing so much, because the progesterone and the estrogen are at a rise, and then all of a suddenly when you get pregnant or you don't, and if your egg fertilizes, then the progesterone continues to rise to support the pregnancy, but if it doesn't, it drops down along with the estrogen. And for women who already don't, you know, hormones imbalance and stuff, because hormones get imbalanced because of what you eat, because of your environment, what you are inhaling all the time, like all that stuff can throw your hormones off. What you putting down there, like it's everything and anything throws your hormones, especially what you eat. But yeah, so during that time you want to take herbs that help to balance the hormones. And then during that time, you weren't trying to conceive or you just cleansing after ovulation, you can also again start to take your cleansing herbs during that luteal phase again, if you're not trying to conceive. Because if you are trying to conceive, you don't want to take too much cleansing herbs after ovulation, just in case you might be pregnant. Yeah. So yeah, and that's pretty much it.
Woman, know your room. Man, know your mind, my lad. And man, know your womb too. And woman, know your mind. And everything will be alright, my lad. You know? Know it, my lad. Know each other, my lad. Know who you with. You know? Know what you could do. Know what you could do with her, my lad. Or without her, my lad. Yeah? Woman, know your mind. Mind, know your womb. So everything will be alright, my lad. Natural over everything and natural, my lad. Go for it. We have the power to do everything, my lad. To destroy ourselves and to build ourselves. So, choice is yours, my lad. And everything's there for you already. So, love still. Every time abundance.
Guys, Samuel well.